Hey guys, kumusta kayo? And welcome back to my channel. So if you're new here, my name is Moe and I do contents about nursing and skincare and hair care. Okay guys, so for today's video, we will talk about how to properly care for your skin if you have diabetes. Okay, so we will go through some skincare routine, skincare products to avoid, and the importance of managing blood sugar. And so without further ado, let's jump into the video. Alright, so what happens to your skin when you have diabetes? Okay, so I have seen lots of patients with diabetes, and most of the time, I've noticed that their skin is dry, dull, uneven in skin tone. There are, patches of dark spots due to the poor healing of the skin. There's recurrent infection, dry, and of course, like brittle nails. So these are the common ones, but of course, there are more to these depending on the severity of the condition and if they have an underlying or an additional underlying medical condition. So with diabetes, there's poor circulation and this slows down healing and causes our immunity to function poorly. So increasing blood sugar results in thickening of blood, which damages those small blood vessels and nerves in the body. So this is why those patients with chronically high blood sugar tend to have poor eyesight, poor kidney functions, as these areas have very, very small blood vessels, and when those blood vessels rupture, it causes malfunction that are irreversible. Additionally, with high blood sugar, patients also experience numbing on other extremities due to nerve damages. So before we talk about skincare routine or products, most importantly, we have to understand that with diabetes, it's very important to manage your blood sugar level. So by doing this, it's very important that you take your medications on time together with proper diet and exercise, and of course, stress management. Make sure that you're up to date with your doctors for all the treatments and plans. Skincare routine is very important to manage skin concerns associated with diabetes. So with diabetes, you have to be very gentle with your skin and avoid injuries because, as I've mentioned, diabetes, most of the time they have poor healing of the skin, and so we want to avoid any forms of injuries. So when taking a shower, try to avoid hot water as this can cause dryness and could result in skin irritation. I do recommend products that are very gentle on the skin and fragrance-free. Two products that I'm pretty familiar with is the Cerave Diabetic Dry Skin Relief and the Aveeno Skin Relief Body Wash. By the way, I'm not sponsored by these two companies, okay? It's just that these are the two products that I see most of the time with diabetic patients. With Cerave Diabetic Dry Skin Relief, it has ceramide, which, helps retain moisture and replenishes the skin. It also has urea, which is a great ingredient to hydrate the skin. So this product also contains salicylic acid, which definitely helps to get rid of those dead skin cells and smoothen rough and bumpy skin. Just take note, guys, that for some of you that are sensitive to salicylic acid, you may want to consider the Aveeno Skin Relief Body Wash, which has an oatmeal ingredient and much more gentle on the skin. You guys may also use these two body cleansers as facial cleansers. However, if you still want specific product for the face, Aveeno and Cerave do have good facial cleansers. So after having a shower, use a soft towel and just, tap dry, then apply your moisturizer while your skin is still pretty damp. This way, you are preventing water loss in the skin. Use a moisturizer that has urea ingredient, ceramides, and or hyaluronic acid. Again, I do recommend products from Cerave and Aveeno. Guys, don't forget your feet, okay, and the nails, as this part of our body is very prone to skin damage a lot. Vaseline and Eucerin healing ointments are very effective for those dry and cracked nails as well as the heels. You may also use these two products on those extra dry parts such as, your elbows and your knees. Now, shaving. So for shaving, as much as possible, try to avoid using those manual razors, and if you guys can invest in one of those electric razors, it'll benefit your skin a lot. Those manual razors can cause so much irritations on the skin and micro peeling, which just basically ruins the skin barrier, and so we want to avoid that. Guys, make sure that you do your own assessment at home, okay? Make sure to check your skin daily, check your feet, your nails. If you do have wounds, make sure that it's always clean and shows no discharges or malodor, as this is a sign of infections. Those skincare products, whether it's over the counter or prescribed, it's very important to know if they are working or not. If you notice that there are no improvements with your skin within certain weeks, seek medical help right away. Your doctor might change your medications or increase the dosage. Guys, as I said earlier, please be gentle with your skin as much as possible. Avoid injuries, avoid products that breaks or ruin skin barriers, such as those strong acids such as glycolic acid, kojic acids, hydroquinone. In regards to this acid, talk to your dermatologist regarding proper concentration. Those who are in the Philippines who are into Rejuve sets, guys, it's a no-no, okay? Avoid these products as they are so bad for your skin. I did a video about Rejuve sets and why you should not be using them, so check the video here if you're interested. Try to avoid products that has alcohol, as these ingredients most of the time can cause dryness and irritation. Essential oils are another one that can cause irritation on the skin and break skin barrier. Try to avoid those products with scrubs such as these ones, as it can definitely break the skin barrier. With skin exfoliation, limit it to once every 2 weeks and make sure to use a soft baby washcloths and avoid those loofahs or sharp towels. So there we go with another nursing in skincare. I hope that you guys learned something and enjoyed this video. If you guys have any questions or suggestions, please leave them in the comment section down below. Follow me on my Instagram, Facebook page, and TikTok, as I am pretty active on those platforms as well. Anyways guys, makita-kita ulit tayo on my next video, and as always, never self-diagnose and always seek medical help for proper treatments and diagnosis. Bye!